Hi, my name is Susana Arciga. I'm a physical therapist at the Marquette University Physical Therapy Clinic. Today I would like to review stomach sleeping as well as sideline sleeping with an alternate way of positioning your legs. Today I have Kevin here, who was our last intern at the clinic this past spring and just recently graduated from our physical therapy program. And once again, thank you, Alpha J, for coming in today and taping this. So with Kevin here, I will have him position himself on his stomach. And first off, sleeping on your stomach is probably not the best thing to do if you can have a choice or an option. It actually puts more stress on the low back and the neck, and it ends up tweaking a lot more of your joints and tightening things up a little bit more. I usually recommend patients try not to sleep on their stomachs if possible, or to start in a different position. However, I do give options for stomach sleeping, which is what I'll do right now. So Kevin, can you get down onto your tummy? Well, first off, I am giving him a pillow. That's very important to have some type of support underneath the trunk. So it would kind of be underneath the shoulders to about underneath kind of the hips here. The amount of thickness will vary on the curvature of your low back and just kind of your torso in general. A slimmer, smaller frame would need typically would need just a thinner support. Somebody who has increased curvature of their low back or kind of has a more broader, heavier frame might need something with a little bit more medium to full thickness and more firm pillow. So first of all, why don't you get onto your tummy? And so what I'll try to do is position this pillow so it goes right underneath his shoulders, so that there's a little space underneath his chin. And that's really the key aspect of this here. So there you go. So with Kevin here, you can see that it's right underneath here. Now, if it's kind of rubbing against the chin, you feel it's a little uncomfortable, you can have the pillow come down. Is that okay, Kevin?
Yeah.
Okay. So with him, it's just enough. And the reason for this, especially if you're having more of a neck problem, is because it keeps the neck in a more neutral position. It's not tweaked up. You can see I don't have a pillow underneath his head. So typically, I'll see if a person can lay here comfortably. Because it keeps the neck in a more neutral position, and therefore it doesn't pinch on any nerves. It doesn't create some joint locking or any muscle spasming or tweaking. The reason if I had him have a pillow underneath his neck that's too bulky, what happens is he's sleeping like this, which at first somebody may think is comfortable, but after a while this position will tighten up this area. It can lock out joints. It overstretches and overstresses the opposite side. It can set off some TMJ symptoms, some ear symptoms that we don't want. So it's just a different position to get used to typically. And if patients do feel the need to have a little support, I typically will use, or I will recommend they have a very thin pillow if needed. And so here, so you can see the thickness, it's very thin, kind of a thin pancake. And they can always tuck it in. Sometimes that feels better, just like I showed in the sideline and on your back position, where sometimes just that little support if needed, they can tuck it in a little bit more. And how does that feel?
Good. And
once again, if I'm looking at him straight on, I'm looking to see that there's a fairly horizontal line there. I don't want it coming up, being kind of at an angle this way. I don't want it being lower than horizontal. So does that feel okay? And as for arm positioning, usually if you're on your bed, this is typically okay. If you're on your bed, you have a much bigger bed than this mat table. You can kind of have your arms kind of resting here. Now, I just want to make sure, go ahead and stretch them out. Just want to make sure that they're not all the way kind of stretched out, because that could put a lot more tension on these upper neck muscles, and it could create some pinching on the top of the shoulders. So if you have a rotator cuff issue or some shoulder pain and problems, this can start to bother you after a while. However, if you're just a little bit more comfortably out to the side, this should be okay with this. I would just try to avoid, go ahead and do this. I know at first it feels very comfortable. However, what this is typically doing, it's doing two things. It's creating a little bit more stress on the top of your shoulders. This is creating an upward angle of your neck, and then there's less support underneath your neck. And so the neck can actually tighten up in this area as well as the top of the shoulders. So therefore, I would recommend just trying to make it more habit to get the arms down, if you need the arms up at all, and to use a very thin pillow. And I think that's about it.